Good morning. Thank you very much for having me on. I mean, I think there are kind of three key areas to flag immediately. The first is the access to healthcare. Older people are, unfortunately, in a lot of lower income, middle income countries, disadvantaged in the fact that they don't have sufficient healthcare, sufficient health workers trained in the issues that older people face, sufficient access to drugs, or to the provisions of equipment and support that they need. The second area is income. Obviously, the lockdown has had a huge impact on people's ability to earn. A huge amount of older people in lower income and middle income countries rely on informal work to provide any sort of income. Only 20% of older people in those areas have any access to any form of social pension. And so, therefore, with the lack of ability to get any work, they've seen a huge drop in their income.
These are obviously structural problems, and they are being exacerbated in a way. How are you trying to help? You were trying to help anyway. What can you do now?
So what we've been doing more is really working. We work with network members in over 80 countries around the world. We've been really focusing at three levels: community level, working with families to be able to ensure that older people are getting regular contact, getting the supplies of food and medicines that they need at this difficult time. We've been then working with governments to ensure that they are aware of the challenges older people are facing. We've been sharing the voice of older people with those governments and pushing them to implement the responses they need to address the challenges older people are facing, and then also talk with governments and at the global level with the United Nations about the changes they need to make in the long term to ensure older people are fully included in society.
We were hearing a little earlier from a situation in the DRC, and various helplines have been contacted, people complaining about losing their pension money, that kind of thing. When the dust settles, if it does, and however it does, one thing that I want to ask you about is how will attitudes to the elderly have changed? You said, for example, there that you're trying to alert governments to the issue. But one of the things that we've learnt is that many societies and many governments have not exactly regarded the elderly as disposable, but have kind of thought, well, the illness mainly affects people who were going to die anyway. There's been a rather sad revelation of some of our attitudes towards older people, haven't there?
There has been, and I know that you were speaking to one of our network members from DRC, because obviously today is World Elder Abuse Day, and it is unfortunate that we have to have such an event on an annual basis because of the violence and abuse that older people suffer across the world. And this abuse comes in the form of neglect. It comes in the form of physical abuse and emotional abuse, and it is as you said, the COVID-19 pandemic has really highlighted some of the ageism that is endemic within our society, and we need to make adjustments, and we need to ensure that everybody across communities is looking after each other. I think this pandemic is proving to us that you need to look at everybody in society, bring those in at the margins, and include them in a focused approach to improving the communities we live in.
Well, wouldn't that be a nice thing to come out of the pandemic? Many thanks indeed, Justin Derbyshire of HelpAge International.